external and internal?
Mhm.
Okay, we have the apex, the base, anterior, here's a nice big sulcus, posterior, here's that ring of fat. This is the epicardium, this outer layer, left auricle, right auricle. As far as the vessels, the most anterior vessel here is the pulmonary trunk. The pulmonary trunk is going to transport blood from the right ventricle to the pulmonary arteries and then to the lungs. This is deoxygenated blood. Behind the pulmonary trunk, we have the aorta. The aorta is going to transport blood from the left ventricle to the body. This is oxygenated blood. On the posterior right, we have the vena cava. This transports deoxygenated blood from the body to the right atrium. And on the posterior left, we have the pulmonary vein. This transports oxygenated blood from the lungs to the left atrium. Looking at the internal structures. First, as far as the layers, we have the thick muscle layer. This is the myocardium. And then we have the shiny layer that's on the chambers and on the valves. This is called the endocardium. This division here between the two ventricles is called the interventricular septum. Up here we have the right atrium. Down here is the right ventricle. I know this is the right because there's less muscle in the wall than on this left side. Between the right atrium and the right ventricle, we have the tricuspid valve right there. And the tricuspid valve has these chordae tendineae, these little cords, these little strings here that attach to the papillary muscle, and we see a better papillary muscle over here on this side. That's a nice papillary muscle, and you see chordae tendineae attached to it. Now on the left side, we have the left atrium and the left ventricle, over here on this side. The valve between the two is the bicuspid or the mitral valve. Its chordae tendineae again attached to papillary muscle. In the ventricles, we see this waffling or these little slits here in the muscle. Also, we may see things that look like little rods. This is called trabeculae carneae. Trabeculae carneae. Now, going from the left ventricle up, we come to the aortic semilunar valve. You see one of the little pockets there. On this other side, again, coming up, aortic semilunar valve, you see more pockets. And then that blood would then go right up into the aorta. Okay. Again, looking at the vessels from the pulmonary trunk here, we expect this to be in the right ventricle, so let's follow it, see if it comes into the right ventricle. It is difficult to see the pulmonary semilunar valve, but there is the probe into the right ventricle. From the vena cava here on the posterior right, we expect this to come into the right atrium, and indeed there's the probe. From the pulmonary vein, we expect this to come into the left atrium, and indeed, there it is in the left atrium. So on the test, I could have the probe going through any of these vessels. I could ask, name the vessel, what chambers it's going to, where's the blood coming from, where's the blood going to, is this blood oxygenated, is this blood deoxygenated. Okay? Did we get all the structures?
I think so.
All right, enjoy. Well,